What's up, D learners? It's your girl, Lady D Talford, Training Solutions. What's up, guys? So, today the topic is case management. So, I get this question a lot from parents and from people in the community. They want to know what in the world is case management and why would I even care about having a case manager for my young child? Well, in every state is going to be different. So I'm going to try to speak in broad terms about what case management is and maybe what situations you might want to have a case manager. So, um, based on what's going on with your child. So, let's say your child is considered at risk or your pregnancy is considered at risk. You might have fibroids. You might have had preemies before. You might have had children with low birth weight. Those situations make it a higher risk pregnancy. And in those situations, you may want someone to just be a second set of eyes on you and the baby. And then once the baby is born, to make sure that development is occurring the way it's supposed to be and on target. Yes, you can do this, your family can do this, your spouse can do this, but it helps to have that expert. Now, this is not to discount your pediatrician, but most pediatricians are not developmental pediatricians. Their expertise is health, developmental specialists, people who case manage development. That is their specialty. So that is why your pediatrician will usually refer you out for case management as well as therapies, because that is not their specialty. Their specialty is medicine and the ability to look at a situation and say someone may need to be referred somewhere. So I do have my notes here because I want to stay on track. I want to give you guys facts about what case management is. Another situation that you may want case management is if your child has a documented developmental delay, meaning you had some kind of evaluation or testing and your child came up with a delay. That's a situation you may want case management. If your child has a genetic condition or some kind of condition like sickle cell, Down syndrome, you definitely want a set of eyes on your child that's not just you and your family, that is an expert in children with developmental delays. So the case manager is your main contact for whatever program you are in. So whenever you are referred to a program, a case manager or service coordinator will contact you and they will be your main point of contact. So then their job is to assist you in finding the support to meet your need, whatever your need is for that program. So if that program serves a certain type of a need, that case manager's job may be to find you a different program or an additional program to refer you to, and you may be in two programs. This can get exhausting and overwhelming and confusing, but what's important to understand is that this is all for your child. This is all for their benefit. So it's not to say that the more people in your life and the more services are better, because that's not what I want you to think. I do want you to understand that having people with a certain expertise is very beneficial to parents and families. So depending on which federal law, state law, program standards, or grant the people that the program is funded by, that's how the case manager and how frequently they talk to you or meet with you is determined. Some programs have case management that's face to face, so you'll see your case manager once a month, once every other month, once every 3 months. Some programs have case managers that only do over the phone. For some case managers, they come to your home. For other case management situations, you may have to go into the case manager's office. It just depends on which program and which state you live in. So, what does even a case manager do? What is their role? Well, making contact with you as the family, making sure that they introduce themselves, who they are, what their purpose is, why they have your case. So they're supposed to clearly explain to you what their program is and why you've been referred to that program. For example, they need to let you know, hey, your doctor referred you to this program because you have a history of preterm pregnancy. And our program works with moms with preterm pregnancy. Or your doctor referred you to us because this is your first child and you are at advanced maternal age. You're over the age of 35. And our program makes sure that your pregnancy is safe. Another situation might be your doctor noticed that your child failed in developmental screening, referred you to this program so that your child's development can be screened by some evaluators. So no matter what the program, someone should call you to touch base with you, and that person might be just the intake person, but eventually you should make contact with a case manager. So what's next? They need to make sure you understand your rights within their program. Every program has a set of standards, a set of rights, and you need to be able to understand what your rights are in the program you have been referred to. So that's part of the case manager's job, is to make sure that you understand your rights in the program. What are the eligibility requirements? So it just may be, hey, do you have Medicaid? Hey, do you have Blue Cross? Hey, do you have Cigna? Just having a certain type of insurance might automatically qualify you for this program. There may be some other standards, and it is the role and the job of the case manager to make sure that you know exactly what the standards are and the eligibility requirements. So case managers are there to help you make decisions. So you're the expert on your kid. That's probably about it for most parents. Most parents don't know much about anybody else's kid, anything else that's going on. It's just enough to know what's going on in your own household. So the case manager presents information to you and then kind of gives you, well, in this situation, this is the typical protocol. So it's kind of like, I call it a buffet. They give you all this information, and then you go up to the buffet and you're like, okay, I know I want this off the buffet, but I don't know anything about this. Tell me some more about this. What's in it? How does it smell? How does it taste? I mean, what was your experience when you had it? The same thing. They are helping you sit through the buffet and say, how about we start with this? And then guess what? If it's something on the buffet you don't like, you know what? You go on ahead and throw it away and go ahead and go up to the buffet and get something else. And that's why you have the case manager, so that you can say, hey, I know you said that this might taste good, but I got to the buffet. I got it off the buffet, ate it. It was nasty. It's not for me. Can I get something else off the buffet? And they're going to help you pick something else. So they also help with finding supports. So the supports should be based on whatever plan the two of you make. So in different plans, sometimes they're called goals, sometimes they're called outcomes, but regardless, it's a statement that says, this is what we want to see happen. So sometimes that statement is based on a skill. We want the child to be able to do this. We want the family to be able to have this. Sometimes it's based on a resource. And then usually for children who are very young, in certain programs, it might be based on a routine. Sometimes it'll say something like, during meal times, Johnny will, dot, dot, dot. During diapering, Johnny will, dot, dot, dot. So depending on the program you are in, you may have a specific statement, you may have a more general statement. Regardless, you as the caregiver or parent is the one that is part of making that goals, but based on the program, you're going to see your goal look different. So for one program, your statements might be very specific, very detailed, very lined out. For other programs, it might be more general. So basically what you do is you meet with somebody, you give them the information about what you want, and based on whatever program you end up in, the statements are written based on what you wanted, but it's written based on the program standards or the grant standards for that program. So what else does a case manager do? Provides information and resources. So one of those resources can be me, DTalford Training Solutions. So definitely click that like button if you're liking my content. Subscribe, share this with people that you know. Definitely love for you to just be a member of the D-Learners community. So I don't know why that was awkward, but anyway, so resources. Usually case managers have a wealth of resources. I know that I keep resources from back when I was a case manager. I still have resources. And back when I used to do case management, I learned how to have resources and utilize resources. So it's a really beneficial to you to have a case manager because of the amount of resources that they have. They help you find answers. If you're seeing certain things in your child and you're wondering, is this a genetic disorder? Is this ADHD? Is this autism? Is this something related to their heart defect? Is this something that could have happened because we had lead paint in our apartment? They help you find answers. They know where to go, or they know the people who know where to go to help you get those answers. They also help you gather information from various sources. So they will get paperwork signed and they're called releases. So they'll get a release of information and they'll get it from the doctor's office, and they'll get it from this evaluation team, and they'll get it from this medical provider, and they'll pull it all together, and you'll have all your information in one place. I know a lot of people think, oh, my pediatrician has all of that. No, not always. Everyone does not share information, but when you're a case manager and you have someone managing your case, they're getting it, pulling it, putting it in maybe a report for you, being able to share that information with you as the parent or the caregiver. So what else can a case manager do? They can assist in planning. So a lot of people are not good planners. So a lot of times we know what we want ultimately for our family, for our children, in our life. This is what we want. Most people don't know what the first step is to get there. There's so many times that I just hear people say, I just want him to live a normal life. What does that even mean? Like, you need someone to help you to define, first off, what is a normal life to you? Because a normal life to you is not a normal life to her, is not a normal life to him. So what is a normal life? So the case manager can help you with these broad general things that you want. I just want him to love the Lord. Okay. What does that have to do with the fact that he's not walking? But these are the things people want. I just want him to be in a regular kindergarten class and not need any special help. Okay. What steps do we need to do to get here? planning. Then not only do you plan it, but then you have someone to execute the plan, review the plan, monitor the plan, and make sure the plan is working. How often do we make decisions and we're like, oh, I want to do this, and I'm making a plan to do that, and then there is no review of that plan. We don't even know until we've completely failed that the plan didn't work. So that is a great part of having case management, is being able to have assistance with that plan. They facilitate conversations with doctors, therapists, community partners, just other agencies, teachers. Case managers can help with all of this facilitation, because sometimes we're in situations where people are not getting along, they're not understanding each other. So just the great part is a case manager can assist with that. They also can help with seeking and acquiring different resources. Some places do not take referrals from parents. They will only take them from a partner agency. And case managers know this. They know about these agencies and they're able to connect you. So they can help you with scheduling appointments. There's been times where people will say, oh, this doctor's specialist office said 3-month wait. My case manager called and got me in the next day. I mean, they're not that magical, but I'm just saying though, the case manager can help you kind of execute things, maybe move things along when you're struggling as a parent, because a lot of times they'll have rapport with different people in the community. Then you've got monitoring services that you might get. So they will follow up on your satisfaction and your family or your child's progress or your progress within the program. So that's another great thing about case managers, is that they are monitoring success. Then you also have completing and explaining paperwork. So what does that mean? Well, not everybody is on the same reading level. Not everybody understands the same medical terms. Yes, when your child gets sick, when your child's in the NICU, when your child's in the hospital, we learn the medical jargon we need. I learned jargon around neurology and neurotypical when we were investigating my son's developmental challenges, trying to figure out, is it ADHD? Is it autism? What's going on with him? I learned these things. And the funny thing is, I was a case manager and I had a case manager. So even me, someone who is very familiar with case management, because I've been a case manager before for a program, and I had one for my son, because when I'm a mom, I want to be a mom. I did not want to be his momager. And for some of you out there, that's what you want to do. But you are not the expert in everything. I mean, jack of all trades, master of none. We all know that that does not work out. We do not go to the mechanic and ask him, hey, can you help me out? I'm having I think I have a toe infection. Why would you go to a mechanic for your toe infection? Why would you go to a podiatrist to look at your car? Go to the people who have the expertise. So that's what case managers help you do. They help you find the people that have the expertise. They help you with meetings. They help you with facilitation of meetings. They help you with acquiring and putting together information. A lot of people are hesitant because they're worried about state agencies finding out about their child, labeling their child. I say this all the time. Why would you hold your child back out of fear? Out of your fear. Think about all of the progress your child could have made, while you were sitting there saying, I don't want anybody to label them. Who knows? One day your child might be the big head child, the child who farted in class. There is nothing that you can do to stop your child from being labeled. I am sorry, it is not going to happen. And also, nobody really cares anymore. I'm an educator. I don't care that this 10-year-old, when he was 2, got speech therapy. I don't care. I want to know what's happening now. I think it's a lot of ego that worries about these things and not reality. Think about what your child needs and who the best people are to get them what they need. Train up a child in the way they should go, and when they are old, they will not depart from it. You are the most important person in a child's life. Please help them reach their potential.